My name is Asra Khan and my roll number is PP16500044. The assignment is submitted to Mme. Shahana Wahid and topic of my assignment is asparaginase. Asparaginase is an enzyme that is used as a drug to treat acute lymphoblastic leukemia, that is also known as ALL. Only parenteral form is available and is given by injection into a vein, muscle or under the skin. That is, we can give it as IV or intravascular or uh, under the skin as well. E. coli strains are the main source of asparaginase. We have already covered the rational use of the drug, but drug also have irrational use as well. If you use the drug irrationally, following symptoms will appear. And these are the side effects of asparaginase: fever of 104 °F or 38 °C or higher, shows possible signs of infection, nausea, vomiting, persistent upper abdominal pain, and diarrhea, unusual bleeding or bruising, swelling, redness, or pain in one leg or arm and not the other, uh, extreme fatigue, unusual thirst, need to urinate frequently, confusion, excessive sleepiness, hallucination, that is seeing, hearing or feeling things that are not there, agitation or disorientation. What is disorientation? It is not able to recognize familiar surroundings. So these are the following irrational uses of the drug. Dose adjustment. We have few alternative brand for asparaginase. That is one we can see here, Pegaspargase. The Pegaspargase have different doses for adult and pediatric patients. Intramuscular administration should be recommended over intravenous administration. That is, we can give it IV rather than IM rather than IV. Due to the potential increased risk and faster onset of hypersensitivity or intravenous administration. Likewise, we have Arvenia, asparaginase. Both the drugs should follow the protocols of UW Health utilize for treatment of various hematologic malignancies. Dose adjustment for both adults and pediatric in case of Arena uh, should be guided by the patient's treatment protocol and the grade of toxicity that the patient experienced. It is reasonable to consider the dose at one vial, that is 3750 international unit, or bending the dose to 10% as it has shown to yield effective asparagine depletion. These are the 6 disease interactions with asparaginase. We cannot take asparaginase in those following diseases, that is coagulation abnormalities or bleeding, pancreatic dysfunctioning, uh, hepatic dysfunction, hyperglycemia, uh, myelosuppression, and mental status changes. This happens when you take um, asparaginase. There are many drugs with which asparaginase can interact. The list is given. The list have many common drugs which we use, like it has acetaminophen, other than that warfarin, and vaccines, isoniazid, sulfamethoxazole, infliximab, and many other drugs. So we should check the interaction of the asparaginase with other drugs if you wanted to take asparaginase. Here we have alternative brands with their Pakistani rupees, in which we can get this brands easily. We have AminoCore 5S Plus, that is Claris. Uh, it is of 28,000, and Asginase, that is Xenotech, and it is of rupees 2,775. It is economically suitable for patient to take. Other than that, we have Aspanase, that is Intes, and it is quite expensive, that is 38,067 rupees. Drug toxicity and antidote. Asparaginase could be toxic for us. Asparaginase is used in ALL treatment protocols are large molecules of bacterial origin and thus can uh, elicit an immune response in patients. Immune reactions to asparaginase are classified as either clinical or subclinical hypersensitivity, also referred to as silent inactivation. Clinical hypersensitivity is one of the most common reasons for the discontinuation of asparaginase therapy. What is the mechanism through which it causes the drug toxicity? PEG asparaginase is made up of enzyme L-asparaginase that is linked to a substance called PEG, uh, which makes the drug stay in the body longer. L-asparaginase comes to the bacterium E. coli and breaks down the ammonia acid asparagine. This may stop the growth of cancer cells that need asparagine to grow, but when its amount increases the normal level, then it can cause the damage to the normal cell with same mechanism as mentioned above. So it is the mechanism of action of asparaginase, but if the situation is out of control, then this mechanism can be dangerous and toxic for the normal cell as well. What happens if we suffer with um, asparaginase and toxicity? So the antidote is no case of asparaginase overdose with clinical symptoms has been reported. There is no specific antidote. Treatment is symptomatic and supportive. So in the history of clinical pharmacy, there is no case of asparaginase toxicity yet. We do not have a specific antidote for it, but if a person suffers with irrational or side effects of asparaginase, then symptomatically treatment is available. To understand the drug more, we can see a case study here. A 14-year-old child was admitted because of 10-day history of fever, facial paleness, and weakness. Physical examination revealed splenomegaly, but there was no evidence of peripheral lymphoma. The laboratory results were as follows: hemoglobin 61 gram per dl, white blood cells count 4.1 to 10 to the power 9, differential monocytes 13.8, lymphocytes 63.7%, uh, platelet count is 124 into 10 raised to 9 liter. Bone marrow smears were performed and showed increased circulatory with a lymphocytosis of 88.5%. Chromosomes analysis lead to classification of sample with the diagnosis of beta cell acute lymphoblastic leukemia. The test results were not uh, accurate, so the B cell acute lymphoblastic leukemia were diagnosed. Uh, we have already read and observe the subject, our object, and most of the point of our soak note in the case. So here I am suggesting my treatment, that is after one course of danirubicin, vincristine, L-asparaginase, prednisolone regimen, the patient achieved complete remission and the absence of central nervous system leukemia was confirmed. It is as simple that we have to take the different regimens which contain our drug of choice, that is asparaginase. Uh, the second course of treatment was a methotrexate 4-gram infusion. 3 months later, within 24 hours of methotrexate, uh, we will give leucovorin 30 mg by IV, intravenous muscular injection every 4 hours for 24 hours. Hydration, urine alkalinization, and pH less than 7.5 were maintained in this case. There was no impairment of liver for renal function. So this is my case, and here are all the references from which I took my case, as well as uh, others content. Thank you so much.